Hey, Russ.
Hey, Candace.
Dr. Russ, how are you?
Well, it's interesting times we live in, but I'm doing good. I mean, I'm trying to finish a book, so there's nothing better than for writers than being quarantined,
Yeah, no.
you know, or at least social isolating. I don't have to see anybody, I don't have to meet anybody. I just have to sit and write, and that's what I've been doing. So, almost finished the book, and we published in July. So,
That's so exciting.
yeah, looking forward to it.
Yeah, it's an editor's dream and a publisher's dream to have a writer locked in where they can't move.
Exactly. Yeah, exactly. So. Yeah, so it's been, and I've got my family here. I've got my dogs. My daughter and grandchildren are down the road. So, you know, the other day I went and waved at them through the window, and
Wow.
it's actually been not too bad. And I've got a lot of friends, as you know, in the healthcare industry, and
Mhm.
and I'm been out of that for a few years now, and I'm you know, part of me wants to get back into it and do what I can. The other part is like, okay, well, you're doing your work helping people with the book. So that's mostly what I'm telling myself right now.
Oh, you have so much to offer outside of the traditional block of medicine. So, and
Thanks.
so, yeah, so so we met, I'm thinking at least a good 10
Oh,
years
it's more
ago.
than that. Yeah.
It
I
is?
think it's around, yeah, I think it's around 2007, I think. So it's been like
Wow.
13 years, I think. Because
Wow.
I knew you before Jim came along, I'm pretty sure.
Yes, you did.
Yeah.
Yes,
So
you
there you go. In the
did.
pre-Jim days. Yeah.
Yeah. Free gym days.
And we don't mean working out Jim either. We mean the husband Jim.
The husband gym. Yeah. Yeah, no, that it has been a long time. And I was introduced to you by mutual friends, and you were doing medical stand-up comedy, and which I still admire about you because it's amazing. And yeah, and you have certainly evolved in your career and life and have really walked the walk of a lot of your patients. And that's really what you bring that's so valuable. I come from a family of medical doctors and nurses, and so we have medicine in our family. Very few physicians are touched the way you have been in something that is so dominant right now, particularly with this virus, is the tremendous amount of anxiety. And out of your own suffering, you have created incredible resources like the Anxiety MD, which I'm going to have you share a little bit about, and then
Sure.
your upcoming book, which, by the way, what's the title of your upcoming book?
I think it's going to be called the Anxiety RX. I'm pretty
Nice.
sure that's what
Nice.
you and I talked about this years ago about that patient of mine who emailed me and said, Dr. Kennedy, I need you to renew my perception. And, uh, and it was like, she meant to say, I need you to renew my prescription. But when I saw renew my perception, I thought, oh, that's going to be the name of a book one day.
Yeah,
Because it was just too perfect.
it is
So
perfect.
yeah, so we'll see. That probably will be like a subtitle or something like that.
Yeah.
Renewing your perception.
Well, let's get right into it.
Anxiety really is all about your perception. Yeah, yeah.
Yeah, it really is. So there are so many people saying, "Oh, you're going to be interviewing Dr. Russ. Oh, we want to hear what he has to say." They are filled with anxiety, and these are frontline healthcare workers. These are everyday, ordinary people, housebound people, people that are already medically compromised due to core illnesses, asthma, respiratory. So as a medical doctor and fellow humanitarian who understands anxiety better than just about anybody, what can you help us, all of us, with in understanding how we can approach this tremendous extra anxiety?
Well, I think it's just staying where you are, realizing, asking yourself this question: Am I safe in this moment? Like right now, am I safe? Because the thing about anxiety is makes you time travel into the future. That's what anxiety does, right? So when you go into the future, you have no grounding. It's all your projections, and it's projections based on your own past fears and your own past worries that you just sort of grab from your past and then throw in your path. So of course they're going to scare you because you picked them. It's like the old, I think on Facebook one day, I posted something a little while ago about, your parents will always know how to push your buttons because they're the ones who installed them. Right? So it's one of those things where, you take your worst fears from the past and then you throw them in your future. And of course, they're going to scare the crap out of you because they're your worst fears, and you look at other people, I look at people who are afraid of going bankrupt. Not that that's, any less of a worry, but with me, that hasn't been a problem. And I've had money issues at points in my life for sure. But it's not my problem. Like, that's not my thing. My thing is, is I'm a hypochondriac. So, that's my thing.
For a medical doctor with a lot
exactly,
of knowledge.
exactly. So I'm I've had every test known to man because I can order tests on myself, which is great. And I'm still waiting for my pap smear to come back, and hopefully it'll be
I
good.
hope it's okay, Russ.
I hope it's okay. I hope it's okay. So yeah, and as you were saying earlier, I did stand up for 15 years. I was a doctor in the daytime and then stand up at night. And I think laughter is great for people. I think laughter it pulls you into the moment. Anything is sensation based, and that's what I've been telling people. Trying to get into your sensation, because the thing about what anxiety does to you is it projects you into the future. It does this mental time travel of it projects you into a place that you don't want to be because you think that you can protect yourself from it. If you worry about it. Brene Brown talks about this, like, no matter how many times you practice that phone call from the school saying that your child's been seriously injured or whatever, or there's a shooting or whatever, no matter how many times you practice that, it's not going to get you any good at it if it actually does happen. In fact, it wears you down to the point where that you can't have you don't have your resources anymore. And Norm Macdonald, I love Norm Macdonald. He's one of my favorite stand-up comics, if not my favorite. He goes, whatever, what doesn't kill you makes you very, very weak. So it is. So again, the fundamental thing is to stay in the moment, like stay in your sensation, because you can't like, I don't know what time I'm going to pee tomorrow. I'll pee tomorrow when I feel like it. Like, it's just like you can only feel now. So when you bring yourself in a feeling of your breath, or you rub your hands together or touch that brings you into the present moment, and that takes you automatically out of these anxious, ungrounded fears of the future. So you're no longer mentally time traveling into the future where there's no stability and grounding, and you just get worse and worse and worse. And it reminds me of, label your fears. When you have a fear about something, like, label it. Say, this is an intrusive fear. This is something that I always think about. This is an intrusive fear that comes in. Because what that does is it starts using the rational part of your brain. When you start labeling something, I'm afraid of getting, COVID-19. I'm afraid of the illness. I'm afraid of when you start labeling, this is an intrusive thought. Then you pull yourself into the rational part of your mind, as opposed to when you say, I'm afraid of getting this virus, you're completely using your amygdala. You're completely using the fear-based part of your brain. And then when you start bringing rational curiosity to it, then maybe half of your brain is brought into rational thought. So you weaken that fear. I don't know if that made a whole lot of sense, but what you're doing when you label these thoughts is you're bringing some rational energy to your brain, when before you were just being overtaken by this sort of implicit fear that has no like substance to it. You're believing something that has no substance to it.
Can we do a little practice? Can we just sort of role play like I've got that COVID fear? Maybe I've got a sniffle and, okay, I'm coughing a little bit, and I'm coming to you and I'm saying, okay, Russ, I'm in a full-blown panic here.
Right.
I need you to talk me down off the ledge.
Yeah.
I can't function. So I'm scared right now that I've got a bit of a slight elevated temperature, I think. And I don't even have a thermometer, but I'm pretty sure I do. And I've got, I definitely have sniffles, and I've got this little cough. Help me.
So I wouldn't even, at this point, I would say, well, there's no point talking about this. Basically, what I've got to get you to do is get you into your body. So I get you to put your hand on your chest, just rub your chest a little bit, come into that sensation, maybe put your hands on your face and just bring yourself.
No.
Yeah. Yeah. So maybe it's like, put your hand on your chest and just put your hands on your arms, put your hands on your thighs, like get yourself in a sensation, you know, taking in a nice, slow, deep breath and really feeling and paying attention to that breath, because sensation will bring you into the moment. That's what you need to do. More thoughts are not going to help you. Like I could reassure you, like the chances of you having this are low, whatever. You're not in your rational mind. So why am I trying to give you rational thoughts that will alleviate it? Because it won't, So the only thing that helps is bringing yourself into your body, bring yourself into the present moment, because that pulls you out of that amygdala based, oh my God, oh my God, oh my God, the world is coming to an end, and it pulls you into sensation. And when you're in sensation, at least you have some grounding, because you're here in the moment. If you projected yourself into the future, there's no grounding there. Now I realize that we have to prepare ourselves, and this is the Brene Brown thing about practicing that call from the school, saying your child, that's not going to help you. Right? The thoughts are not going to help you. So I tell people, as soon as you start feeling anxious, it's kind of like ABC. The first thing you do is become aware. Good. What do? The B is for body and breathing. So you get into sensation, you get into your body, you touch your chest. I guess don't touch your face, because that's probably not what you're supposed to do these days. Rub your thighs, rub your chest, rub your fingertips together. Like get into sensation, because that will pull you out of this thought, because no thoughts are going to reassure you at this point, because there are no answers at this point.
And so you're dealing rationally. You're dealing with a overloaded, stimulated amygdala that's run amok.
Exactly. And then when you get into what I call survival brain or alarm brain, then you focus preferentially on threat. And it's evolution. It's how we're wired. So we're wired to believe that all threats are physical.
Right.
Stone Age brain in the digital world, even though most of our threats are internal and emotional these days, as opposed to external and physical, we try and deal with it by thinking our way out of it. And you can't think your way out of this. Like there are no answers. You can't reassure yourself to the point where the only reassurance that works is going into your body, breathing, taking some time out. I have a hypno meditation on my website that's free, actually, that I just made about 4 or 5 days ago to boost your immune system at the end of the interview. And it's free. You just go on it, download it, and I listen to it twice a day. I listen to it when I first get up in the morning, and I listen to it when I go to bed at night. And it has suggestions like don't touch your face, right? So I guess my earlier thing about touching your face is probably not a great idea. So don't touch your face. Drink lots of water. You keep yourself in this sort of mental framework of that your B cells and your T cells are active inside you. Your immune system is strong. You're going to have the strongest possible based on where you are in life at this particular moment. And I do believe on some level, without going too flaky, that we can influence our body with our minds. I mean, I think there is a certain amount of influence that we have with our minds. So if I say every morning that my B cells and T cells are really working optimally and they're functioning perfectly, and maybe it doesn't, but it certainly, in any event, if it doesn't help, then I haven't lost anything. If it does help, then so basically what the hypno meditation does is it puts you in a bit of a state of hypnosis, takes you into a bit of a hypnotic induction. It gives you suggestions that say, don't touch your face, drink lots of water. Your immune system's getting stronger every day. It's healthier every day. And, and it relaxes you at the same time. So it brings you into the moment. So that's what I like about it. And it's free. I made it for everybody because I want to do something for everybody that isn't, trying to take advantage of people and make money. I mean, I really do want to help people through this time. And I think that is one of the things that I can do and that you can do yourself to listen to something that's going to make a difference right now. And even if it only relaxes you, then that's good enough.
And there's an old proverb that says a merry heart does good like a medicine.
Yeah.
And the joy and that's why comedy for you, I think, is such a perfect marriage, because that joyfulness, you can't be miserable and joyful at the same time. So
exactly.
Then your endorphins kick in, and then would you say that managing your amygdala, that panic piece, would be like I know I've heard you say you don't address it because it's like a rabbit hole. It's just going to keep on going. However, is it a good idea to say to your amygdala, I hear you, you're screaming, but we're going to focus on rubbing our legs right now? And is that a good idea to acknowledge that the fear is there, but that we're going to focus on something else? Or should we just shut out that amygdala altogether? What do you think?
Well, my thing is, if you're going to think something, think, am I safe in this moment?
Okay.
If you're going to use your brain for anything, just think, am I safe in this moment? And we're always safe. I mean, right now, or your listeners or whatever, just look around your room, look around where you are, and really realize that in this moment, even with all the hysteria going on, that you're actually safe. You're actually safe in this second that you're in right now. And if you wake up in the middle of the night in a panic, just ask yourself, am I safe in this moment? I know that I'm freaked out. I know my amygdala is going crazy, but am I safe in this moment? And then realize that you are safe, and then sort of just sit in that safety. So we're such a heads up society these days that we can think our way out of everything. And one of my favorite sayings is, you can't think your way out of a feeling problem. So you can't think your way out of this issue. So yeah, you can talk to your amygdala as far as that goes, but I would really encourage people to go into their body first, and that's that ABCs thing that I was saying again. So you're aware that you're anxious or worried or scared or alarmed. I like the word alarm better than anxiety, because I think it actually relays more on a conscious level, because that's what really anxiety is. It's not so much as alarm. It's alarm in the body. And then go into your breath and your body, because it's like your ego is going to try and suck you into thinking, and it's a trap. It's really a trap. It's not, there's nothing you can think that's going to reassure you right now, because there are no thinking solutions at this point. So all you have really, and all we all have, is the moment that we're in, and just focusing on the safety presence in your body without getting into too much thought. Because all thought does is it just winds us up even more. I mean, you might have one thought out of 10 that's reassuring, but 9 of your thoughts out of 10 are probably going to make you worse. So don't even go there. Like, I'm really, you hit the T intersection, turning right is thinking, turning left is feeling. Just turn left each time. And then once you reestablish yourself in the body and you feel grounded at that point, then you can go back to thinking. But realize that when you're impaired, and I was saying this earlier on, when you're in survival brain, you're not operating with your rational mind. So everything is going to seem worse than it really is. So why would you want to think about something when your mind is already poisoned against it? Because if you're going to think, you're just going to make it worse. If you go into your body and, get into your breath and get into sensation, that's going to help you every single time. If you go into thinking, that's 9 times out of 10, that's going to make you worse. So which way should you go?
I like how you use the word impaired. That struck me right away, because I'm thinking, I'm mentally drunk. I can't trust my brain right now.
You can't.
I wouldn't get behind the wheel of a car if I've been impaired, and I can't trust myself to use that part of me that's impaired. So that really relates to me, to understand my brain is impaired when I'm in this alarm state, and I need to go and not listen. And like you said, go left, creating feeling.
Yeah, I mean, it's focused preferentially, and this is for evolution. This is thousands and thousands of years of evolution. It's like when we zero in on where are the threats, where are the threats, where are the threats, and we preferentially look for threats. We don't see solutions at that point.
Right.
When we get into that stage, there is even parts of our middle ear that constrict to look for and preferentially adjust to danger. So we don't hear calming voices when we're alarmed. We may hear them, we may perceive them or detect them, but they don't go into our system and they don't soothe us, because we don't allow that frequency, because we're in alarm mode. So we preferentially look for threat. So and if we don't see threat, this is the thing about anxiety in general. If we don't see an obvious reason for threat, we don't see an obvious reason, our mind will make one up.
Right.
So your mind is impaired, and it's impaired, and it's also skewed to look for threat. And even if there is no threat present, it will start trying to find one. And the perfect thing right now is looking at COVID. I mean, if you're anxious, if your body is alarmed, you're going to preferentially look for threat. And that's all the answer you need right there. So of course you're going to get into it and just go to town. So I'm saying, when you get there, turn left. Don't go into thinking, because your thinking is not, even though your ego's over there going, hey, we can think our way out of this. We can think, and look, we'll figure it out. It's like, that is a trap. That is a trap. When your mind is impaired, do not, it's like you said, if you're impaired, if you've had 5 shots of tequila, don't sit behind the wheel of a car. Like, that's basically what you're doing, is when you start thinking and you allow yourself to think, you're basically allowing yourself to just freak yourself out even more. So go into your feeling, and then once your feeling comes back, once you've relaxed your body again, then your rational mind comes back, because you're out of survival brain, that emotional limbic survival brain, and then you can think rationally again. But while you're in it, like, the more you think, it's just this snowball that just gets worse and worse and worse. So it's like, when you have the awareness that you are anxious or you're alarmed, know that you just have to go into your body at that point. And any thinking at that point is going to make you worse. And here's one more thing before I know I'm speaking quickly here today.
I want you to.
Yeah, but here's one more thing, is like, when you get into this alarm thing and you start thinking, is that you stop seeing the ability to stop thinking. Because as your alarm raises, your mind gets more and more impaired. It starts believing your thoughts even more, which makes you more and more alarmed, which impairs your mind even more to be able to think rationally. So you get into this snowball where you can't get out. The only way of getting out is becoming aware. And then when you're aware of it, going, okay, can I just settle into my sensation now? Can I put my hand on my chest? Can I connect with myself? Can I just stop thinking? And in a way, you can kind of train yourself to just sit with a sensation, even if the sensation is uncomfortable. Like, even if you have this alarm sensation in your body and it's uncomfortable, you can still sit with it. But if you keep adding thoughts on it, and this is what I talk about, this alarm that gets in our system, it's kind of like this smoldering fire. And the thoughts are just like throwing little matches on top of the smoldering fire. And the smoldering fire is never going to go out, provided you keep tossing little match heads on it, because it's just going to keep flaring every time. So what you have to do is stop feeding the feeling. You have to stop feeding that smoldering fire with these little matchsticks of thoughts, because they're just going to make it worse. But the thing about that makes it hard is that your ego is going to tell you, look, we can solve this by thinking. And you can't, and your mind is already impaired. So you can't solve something with an impaired mind. And then the impaired mind's going to tell you, no, we're okay, we're fine, we're not impaired. We're actually seeing reality here when we're not. And yeah.
I love that. It makes me think of, a Rachel on Friends, where her and Phoebe had this thing where they said, when they're drinking, when to stop. And,
right.
and the code word was, okay, you're there, there, stop. And but to me, it sounds like, and tell me if this is correct, it sounds like, just like you would when you're teaching your children, don't drink and drive. When you're at a party, people offer you drugs, don't do it. You're talking about this when you're in a rational state and in a calm state. So it sounds
absolutely.
Would that be like, well, when we're in those calm states, is that the time that we create a plan for ourselves, so that when we hit those moments, that we then take ourselves out and go through the sensation process? And the reason why I'm thinking that is, like, say someone that has a seizure condition, for instance, and they have these seizures that come upon them suddenly. I've seen piles of medical videos where these people, they either have an animal that's trained to sense when the person's going into a seizure, and the person knows it themselves, and they start to lay down and do what they need to do to get them through that process.
Right.
Is this the same kind of idea of having a plan in advance for alarm?
Yeah, but most people won't do it. But it's a great point. It's like, when you're feeling calm at these points in the day, that's the time to practice. Okay, I'm going to go into my body again, because most of the time in the society, we don't do anything unless we have to. Right. So the time to practice is actually when you have your rational mind, when you have the ability to I could practice just breathing right now. I could just practice I'm feeling good. So I could just practice that. Because here's a story that I usually tell people. In the in the military, when they train fighter pilots or pilots of any kind, they put them in this room and then they slowly suck the oxygen out of the room. And they get them to divide cards into black cards and red cards, right? So what happens is slowly they suck the oxygen out of the room. So what they'll do is that their brain function will start to go a little bit, and each one of them will have one of them will get a headache, one of them will get nauseated, one of them's fingers will start to tingle. And what they'll say is, this is your tell. This is your tell. When you're in the cockpit and you're losing oxygen, you have this knee-jerk reaction of flipping on your oxygen mask. You just automatically, as soon as you feel that sensation if you feel nauseated, you flip it on. If you feel tingling in whatever your particular sign of hypoxia or low oxygen is, as soon as you see that, then you flip it over, because this is the problem. Once you get past 30 to 40 to 60 seconds into low oxygen, you stop having the ability to see that your oxygen you're losing your oxygen. So if you don't do it right then, basically what happens is, and this has happened before, is that you will lose oxygen to the point where you can't even recognize the fact that you're losing oxygen. And then if you don't put your oxygen mask on, you wind up just diving into the ground, because you go unconscious is basically what happens. And that's exactly what happens with fear, is that you get thinking and then you start believing your own thoughts. And then when you do that, you're so impaired by that you can't see your way out of it anymore, because you're too deep in it. So if you can see it coming, like with the seizures, if you can start, breathing, getting into sensation, grounding yourself, then you can have a chance of pulling yourself out of that, flipping your oxygen mask on and staying conscious. Other than that, you're just going to get sucked into the maelstrom of, whatever your thoughts are, which is just going to impair you more. And then the more impaired you get, the less able to see that your brain is impaired, and you start believing everything you think.
Right. And when I think of medicine, so, you are obviously a physician, but in my background, I've been trained for CPR, and you practice it. And so then when those moments come, and I've had only a couple in my life where I've actually had to kick into that training. And even though the adrenaline's kicked in and you're, obviously caught up in the moment, that training actually helps bring you to the place where you can focus on that individual at the moment and try to do the best you can for that person. So I think adrenaline is, it's going to be there, but the training in the calm time helps it to kick in when you need it. And I think that that's super important. Is there any way that you would recommend, or have you learned to involve maybe a close family member that you're living with that can help you? Like, so if you're quarantined at home, or you're quarantined as a result of the physical distancing and the responsible behavior that we all can participate in, is there a way that you can involve a family member or a partner to help if you're just thinking that you're isn't it?
Yeah. Well, I mean, what I would do is offer the help when you're okay. Like, one of the things, the statements that I love is when you fall to preparation. So if you've prepared for this, when you get stressed and you do start getting into impaired mind, you'll fall back to your highest level of preparation. I used to do this in stand-up. I would practice my bits and my routines over and over again. I wouldn't like get it so it was rote, but I would know it really, really well, so that when I got nervous on stage, I could still perform it at that level. Mm-hmm. So what I would do is ask the people that you're with, like, what can I do for you? Like, when you get into stress, like, what do you need to hear? Can we work together? Can we sort of, stimulate each other, hold hands, eye gaze, that kind of stuff. Anything that brings in that social engagement system, because that's really what you need to log into, is this, I wasn't going to get into it because I don't want to get too complicated, but there's something that we have called the social engagement system. It's also called the human resonance circuitry, but it's tone of voice, eye contact, prosody of voice, facial expression, that kind of thing. And if we do that to each other, that's what soothes us. So if you're lucky enough to live with someone and be able to make facial contact with them, and really, I mean, eye gazing can be a little uncomfortable for people, but it is one of those things that if you have a friendly face, your amygdala, it automatically resets you into a more calm place. So that's probably the up into the moment of sensation. You can hold hands or whatever. I was going to say touch each other's faces, but here's why I tell people to touch your face. And I guess it's not so much a great thing right now with COVID, but the most brain real estate that we have as far as sensation goes is our hands and our face, right? So if I want to use my hands and my face together, those two things supercharge this somatosensory cortex that we have in our brains, and it uses up a tremendous amount of our brain real estate. So it brings us automatically into the moment. So your hands, if you can hold hands, if you can look at each other, if you can practice, using faces to each other, that automatically will start resetting your amygdala. It will automatically setting the social engagement system that allows us to calm down. So that's what I would do, is if you have somebody else, is get into sensation with them at the same time. And if you can use the social engagement system, so if you can use eye contact, tone of voice, facial expressions, body language, that's to sort of express other person, that's going to be way more effective than saying, take a deep breath. Not that there's anything wrong with taking a deep breath, but it's going to be way more effective because it's actually going to use the human resonance circuitry that we all have as human beings to calm each other down, as opposed to words. Because words, they're helpful, but it's not so much what you say, it's how you say it.
Right.
So if you can say things in a very loving, caring way, making eye contact with your partner or your child or whatever, and you work together with that, that's going to calm you at a much deeper level than the cognitive mind can ever do.
That's excellent. And I have a humorous side like you do, maybe not as eloquent as yours, but it just flashes back to my grandson that was here, before all this craziness started, and he's just 7 months old, but he found the mirror in the office and he began flirting with himself and smiling at the baby in the mirror. So does that work if you're all alone in a house and you've got nobody?
I was thinking, it was funny, I was just thinking about this today, I was, going to the mirror, and this is really hard for people. This is so hard for people, is going to the mirror and actually talking to yourself. Yeah. Not in a Stuart Smalley kind of, I like you, I know you, whatever he used to say.
So cute.
but really, I have this feeling like when you look at yourself in the mirror, you're basically talking right into the emotional part of your brain, which is very uncomfortable for people. It's really hard. Like out of 100 people that I will say, go to the mirror once a day and just, and the thing is, you don't have to say much. Like, I think a lot of people get hooked into mirror work saying, I love you, I understand you. Not that there's nothing wrong with doing that, but I think the more you start getting into that cognitive thinking process, like, what am I going to say? Am I going to say I love you? Am I going to say you're great? Am I going to say I really appreciate this about you? There's nothing wrong with that, but really what you're trying to do is induce a feeling state. So if you're trying to induce a feeling state, just looking at yourself in the mirror and just being loving. And for a lot of us in this society, that's hard because, there's so much self-criticism and what I call jabs, like we take jabs at ourselves, which is judgment, alienation, blame, and shame. So this is what we do to ourselves every day. We take jabs at ourselves every day. So it's really hard. And I find it one of the hardest things for me to do is go to the mirror and do that, but it's so important. So yeah, absolutely. Doing it with yourself, although initially it feels really disingenuous, but after you do it for a while, you start getting used to it. And it really does get you into that emotional kind of regulatory place. And like I said, I'm not a huge fan of saying things, although if you are going to say something, just tell yourself what you appreciate about yourself. Like I go to the mirror and I say, I really, I heard this joke about laughter is the best medicine, right? Like we've all heard that joke, laughter is the best medicine. I used to do that on stage. Laughter is the best medicine, but not if you have chlamydia. because if you have chlamydia, you can laugh all you want and it's still going to burn when you pee, right? So and so I say to myself, that's a great joke. Like, I love that joke. And the joke I wrote the other day about the COVID, like, why everybody the paper, right? Like, people are asking me, like, what's your medical reasoning for why people need toilet paper for a respiratory virus? And I say, well, it's really simple, because if you're in a room and someone coughs, everyone shits themselves.
I saw that. I loved it.
Yeah. So I've been writing jokes in my head about this sort of stuff too. So anyway, getting back to what I'm saying is, like, going to the mirror and being kind to yourself, it's just, but it sounds so corny. Like, it really does. But really what you're using is neuroscience. You're using neuroscience to use that human resonance circuitry, to use that social engagement system on yourself. Mm-hmm. It will work. Like, ideally, it works with someone else, ideally, right. But it works with yourself too. And the more you practice it, the better you get at it, which is what you were saying earlier, is when you're feeling okay during these times of, these tough times, that's the time to practice. That's the time to put your hand on your chest. That's the time to take a few deep breaths. That's the time to realize, am I safe in this moment? Like, am I safe right now? Like, are you safe right now? Are the people listening to this? Can you look around the room and just see that you're safe? I think we all can. And then when you do that, because a lot of people never feel safe. They never allow themselves to feel safe. So when you draw your attention to, there's a whole bunch of shit going on out there. Mm-hmm. But at this moment, at this podcast or whatever, can you look around the room and tell yourself you're safe? Because you are. And sometimes people don't take that second to realize that they're safe. And feeling good. Don't wait until you're panicked to try. That makes it so much harder. So be like the airline pilots or the military pilots. Is like, know your tells. Know when you're starting to head into that sort of scary phase, and then go to the mirror or whatever, or put your hand on your chest, or focus on your breath, focus on sensation, bring yourself into the moment, because when you do that, that's your best. You're using your own brain to soothe yourself. And there's, having another person is awesome too, but really sometimes we don't have that. But practice it when you're feeling good. Like, don't wait until you're panicked. Here's another little thing I said. If I told you, Candace, in 3 months, I will give you $1 million if you make 3 out of 10 foul shots, basketball. Like, would you wait like to the day before to start practicing foul shots? No, you'd be shooting foul shots every damn day.
And I'm going to hold you to that.
Exactly. So what day is 3 months from now? So, and that's what I mean. It's like practice this when you're feeling, when you're not in survival brain.
Right.
Because when you're in survival brain, you're not going to learn anything anyway. Right. So wait until you're not in survival brain, and then teach yourself. For everybody, is that it relaxes you first. It puts you in a hypnotic state. It gives you suggestions. It allows you to kind of relax, and then you can learn and take this stuff in. So the time to practice it is when you're actually feeling calm. It's not waiting until you feel panicked before you start, soothing yourself.
I love that. And it actually makes me feel better, because it was a very personal question. I didn't want to say it right away, but very often in the last many, many months, Jim has been troubled when he's come home, and he's quietly come to me and said, Candace, I don't understand why there are many, many, many lip marks on the mirror, And so now I feel better, because I've been practicing for as long as I can remember,
There you go.
Yeah. In the mirror.
Yeah.
Well, Russ, I just love your commitment to caring your whole life, and then even allowing us into the world of you and your own suffering that you have used for the benefit of others. And you have lots of resources. And I'm going to add those resources to this video link, and then we'll be able to send those around. I really think people are going to be really practically helped today, which is super important. Lots of people are looking forward to hearing what you have to say to help them during this challenging time. I'm going to agree and witness that it's important to pucker up onto the mirror if necessary. And if you don't want to get caught, just don't use lipstick like I did, but I can't see it if I don't have lipstick on. So, but anyways.
Yeah, just wipe the mirror down after you're done though. That's in these days of COVID, you got to wipe.
Yeah, but I'm so excited about it. I just forget. But anyways, so you have, just tell us about the resources that you have available, both in the Anxiety MD courses and this new free course that you've offered. And then we'll also do a written link.
Yeah, I mean, well, basically, if you just Google the Anxiety MD, you know, THE anxiety, however it's spelled, and MD, and you'll find that. And I've got a YouTube channel, and I've got my website. There's something called hypno meditations that I make for people with anxiety, but I've made one specifically for this COVID thing. So basically, you go on there, it's free download. You just download it, listen to it, and it'll boost your immune system, and it'll also relax you too, and give you a little bit of grounding in these times where we're not so grounded. But usually, just the anxiety and have to remember, and then just Google that. You'll find all my stuff there, my website, my YouTube page, my Facebook page. It's all, if you look on the first page of the website, you'll see at the top there's like Facebook, Twitter, all that kind of stuff. You can just click on all that stuff, and there's all sorts of stuff on there that's like free hints and tips and that kind of thing, because I have a very different view of anxiety than the psychiatric and the psychological professions. I believe that anxiety is in the body and only reflected by the mind, whereas they believe that anxiety is in the mind and reflected by the body. So you have to fix it from the body first, and that's why I say go into sensation. That's the only way to fix anxiety long term. If you're just fixing the thoughts, you're basically just putting a Band-Aid over it. It'll help for a little while, but it won't fix the underlying problem. So thank you for all the work that you do, Candace. My God, you're always helping other people. You're always like, you've been, for times over the years for, helping others. And thank you for doing all the stuff that you do, because we love you. You're awesome.
Aw, thanks, Russ. Well, let's end this with hashtag kiss a mirror after you've cleansed it.
Okay. Fair enough.
Thanks, Russ. Take care.
You're welcome, Candace. We'll talk to you again soon.
Okay. Bye-bye.
Bye for now.